Hi, my name is Donna Stanzak, and I'm the clinical educator for the Surgical Intensive Care Unit at Georgetown University Hospital. And I'm here to talk to you today about the use of self and determining and refining your teaching style. So when you talk about your teaching style, the first thing you have to ask yourself is, why do you want to become an educator in the first place? I have a great love of learning, and I have love of sharing the information that I have. I get a real sense of accomplishment when I can help somebody to understand something, and I get a great deal of satisfaction when I see others become excited about learning. As a nurse, our world is constantly changing, so we're constantly being exposed to new things that we have to learn and that we have to keep up with in order to keep ourselves current in our practice. So once you figure out why you want to become an educator, then you have to think back and you have to develop what you think is going to be your teaching style. So the way I did that is I looked back, think back of some of the teachers you've had during your career. Were there any teachers that you really admired? What were the characteristics about those teachers that made you attracted to them and their teaching styles? Did you think they were effective? And then what about the teaching style that you have? What did you like about their teaching style? I've had teachers in the past that I really didn't like because they stood there and read off slides, and I thought, well, if you're going to read off your slides, then probably you could just give me your slides, and then you nor I even have to be here in this room. And then there's others who can really engage the crowd and get them really excited and make them want to participate in the classroom activities. Those are the teachers that I've admired over my career, and that's what hopefully I've tried to model myself after. So in order to figure out what your teaching style is going to be, you have to know yourself. So you have to do a little bit of self-reflection and think about what are your strengths and what are your weaknesses. And how can you use your strengths to enhance your teaching style? One of my strengths is that I've always been very inquisitive. It wasn't enough for me to just memorize facts. That just didn't make sense to me. I could sit there and memorize numbers, but what use was it? I always wanted to know why. And if I made something make sense to me, if I knew the why behind things, it made it a little bit easier to understand because then all the pieces fit together and it made sense. But to just try and memorize things was just really difficult. And then you have to know what your weaknesses are. I tend to dwell on things. There'll be 100 people in my class, and I'll look at the evaluations always, because I'm always looking for ways to improve myself. So I'll look at the evaluations, and there'll be one evaluation that gives me a poor mark. Well, I will obsess over that one person, and I've talked to my colleagues about it, and one of my colleagues said, you can't obsess over the one person who didn't like the way you were teaching. You have to look at the other 99 who found it to be effective. So that's one of the things that I really have to work on, is being confident in myself and just knowing that that I'm doing the best that I can, and that I will use that any criticism or evaluations to continually improve myself. So once you have a job as an educator, some of the things you need to consider once you have the job, it's going to be, who are you teaching? Are you teaching new grads? I tend to teach a lot of new grads in the ICU. Are you teaching experienced nurses? Are you teaching student nurses in the nursing school? So a lot of times who you're teaching is going to depend on how you teach. And then what are you teaching? Are you teaching theory, practice? Are you teaching policies, procedures? Are you just educating people on new pieces of equipment? Because all of that is going to affect what type of teaching that you do. And then you have to look at, where are you teaching? As an educator, a clinical educator in the hospital, my teaching occurs many places. It occurs in the classroom, it occurs on the unit, it occurs at the bedside, and now it's even occurring online as we're doing online webinars, just like this class that I'm helping you with now. And you also may have opportunities to use a sim lab. So again, you have to look at what environment you're using. Certain teaching methods are more conducive to one environment over the other. And then you have to look at, how much time do you have? Do you have a captive audience that you can hold in a classroom for an hour? Or are you teaching on the unit? Do you have 5 minutes? Do you need to teach on the fly? Do you have 1 minute? Do you need to teach as you go along? So all of those things will determine how you're going to do your teaching. So when you look at how you will teach or what your teaching style is, you have to look at yourself. What are you comfortable with? I grew up in an environment where it was very formal and always lecture focused, where the teacher gave a lecture and I took notes. So that's comfortable for me. But as I'm having to branch out, what are you more comfortable? Are you more comfortable in demonstrating things? Are you more comfortable in assigning projects, group work, independent study? You have to think of all the different ways you can teach. And then what are you teaching? Because again, depending on what you're teaching, some of the things that I teach, especially for the new grads, are facts. Some of those things, there's no getting around it. You just have to teach facts, and you have to give them in a lecture style. But I usually try and combine a couple of things. If I have to give somebody a lecture, then I try and infuse it with some real-life situations that I've seen during my career, and then we usually do case studies or some critical thinking skills at the end of the lecture so that they can get direct application of the knowledge that you're sharing with them, so that they can get a sense of how it makes sense and why is this important to know and how are you going to use this information. And then who are you teaching? New grads seem to be more comfortable with technology. I myself am an older nurse, I'm more experienced, and I haven't had a lot of technological experience. So right now, our new graduates, we're doing a blended learning method, if you will, that they're doing some of their education online on a computer program, and then we're also combining that with in the room classroom lecture and with little practice demonstrations, simulations, case studies. So we're using a couple of different methods. I found that some of the younger nurses or the newer nurses are more comfortable with this technology and are more apt to be able to use it in a way that's sufficient for them. So my teaching style, as I said, I teach everything from new grads to nurses with like 30 years experience like myself. So I use a variety of teaching methods depending on, who am I teaching and how much time do I have. So you have to look at, I know through my career, I figured out that I'm both an auditory and a visual learner. That I learn by listening and I also learn by seeing and taking notes. So you have to look at who are the people that you're teaching. Newer nurses you can give lectures to and work with them with technology, but more experienced nurses, you have to build on the knowledge that they already have. So you have to look at, just because I'm a good, say, visual learner, that doesn't mean that everyone has that same style. So you have to try and use a variety of methods so that I make sure that I kind of touch on everyone's individual learning needs or the way they learn best. One of the things that people have complimented me on the most in my teaching is that they say that I can explain things so that people can understand it. Like I said, I never considered myself extremely intelligent, so I needed always to break things down to its simplest parts and then put it back together. And as I said before, I'm not a fan of memorizing. I don't think that's to my advantage, because then your head gets filled with a lot of facts and things, and for me it's a little bit difficult to move around there. So what I try and do is give people helpful hints that have worked for me to try and remember things. There are simple things like when we're talking about Swan-Ganz numbers. When we talk about hemodynamics, we have to measure these Swan-Ganz parameters, which is a catheter placed in the heart, and you measure different volumes. Well, if you try and get somebody to remember what are the normals for that, well, you can tell them it's 25, the numbers are systolic and diastolic. So you can tell them it's 25 to 50 over 10 to 20. But that's just a number. How are they going to remember that? If you tell them it's quarters over dimes, which means 25 to 50, 1 quarter, 2 quarter, or dimes, 10 to 20, 1 dime, 2 dime, then that makes it a little bit easier for them to remember. I try and make up little things like that throughout my career as an educator to try and help those like me who are challenged in memorizing just numbers without, having some sort of way to make it easier for you. So when I talk to my new grads, we usually do lecture classes. Like I said, they do computer work, and then we supplement those classes in the classroom where we either clarify or elaborate on whatever was covered in the computer module. After that, we do, like I said, we do some case studies and we do some critical thinking skills, because I find it's best if you apply the knowledge immediately. And then I also work with the new grads when they're on the clinical unit. So if I know what our topic of discussion was for the week, then when I go up on the unit, when the new grads are there working with their preceptors, if I see something that's applicable to whatever the topic of the week was, I'll pull that student aside, I'll pull that nurse aside and go over that with her and ask questions on the unit and see if they can describe some of the pathophysiology and how it makes sense and how it applies to this particular patient. I like to explain things and, again, give rationale for why we're doing things and not just having them memorize things. For the more experienced nurses, you have to build on the knowledge that they already have. They do have a wealth of knowledge and they have experience from their real-life experiences and from patients they've taken care of in the past. So they tend to do better with demonstrations and discussions, and they also do really well with case studies because they can apply it to patients that they've had in the past, and they may have had some contact with the situation at hand, so they tend to, like the demonstrations and case studies better than any kind of lecture format. So once you begin your teaching methods and you figure out what works best for you, you're constantly evolving as a teacher. So you're constantly looking for ways to redefine your teaching style. And that may come in the face of evaluations. You can do class evaluations, peer evaluations. Peer evaluations are important because class evaluations sometimes, if you're imparting new knowledge to people, they may not understand that you're not presenting it clearly. I've had teachers in the past that have been extremely brilliant, but they were not able to communicate that to the student on a one-to-one or a classroom style basis. So not everyone is cut out to be a teacher. I think there definitely are some characteristics, and I hope that I possess them. I mean, I have gotten very good evaluations. People seem to like my method of teaching, but that's only because I think I explain things. I'm sure we've all come across teachers who have read facts or read PowerPoints or read slides or read their notes, and then when you ask a question, they're not able to answer the question, and they're not able to explain anything to it. So again, I like to have my peers evaluate me because they can give a more objective view of my teaching style and not the information. The class participants are good for giving you feedback on what information you're giving them. Your peers are better at giving you evaluations on how you present the material, how clear they thought you were doing it, because they're looking more at your teaching style and not the information that you're giving them. You can also determine how well you're doing in class by how many questions people ask. If people are asking a lot of questions, that may mean that you're not explaining something clear enough. And then you have to do some self-reflection. I try and pose questions to the class, and I like it if students sometimes give the wrong answer, because then we explore that and we go down that aisle and see maybe where did I go wrong in my explanation, and maybe I can make it clearer to them. I tend to prefer face-to-face education because I get a chance to gauge my audience. I can look out there and see if people are paying attention, if people are getting it. That's a little difficult to do on something like a webinar where I can't see the audience and I'm just looking into this camera and speaking to you. So I find that a little bit more challenging. But again, I have to trust myself and trust my experience that I'm doing the right thing. There are other things. You're constantly evolving as a teacher. So when you look at these evaluations, don't be too hard on yourself. If you've done your homework, when you do a presentation, that's the first thing. Do your homework, make sure that you've researched it thoroughly, that you have a plan of attack. I'm very methodical in how I do things, so I tend to start with the broader topics and move them in and narrow the focus. And I need to present things in a logical fashion for me. So I sit down and I always look at my lectures and I say, does this make sense to me first before I present it to anyone else? And then if I'm not sure, I'll get one of my peers to look at it too and see if they get it too, if it makes sense to them. That's one of the things that I've been complimented the most on in my career as a teacher, is that I'm always able to make people that have the ability to present things in a fashion that people can understand it. You know, when you look at, you have to do a lot of self-reflection, and you're constantly evolving. I've had to adapt from being a paper and pencil person to a note card presenter to an overhead presenter to a PowerPoint presenter to a webinar presenter. So you're constantly evolving. And when I first started, I tell you, I used to stand up in the front of the room with my notes, and I had every single word that I wanted to speak on this note paper, and I would stand there and trace it with my finger as I was reading so that I didn't lose my place, because if I stopped for a minute to ask a question and I lost my place, I would get very, very upset and flustered, and then I looked foolish. So I've gotten beyond that. I've gotten to the point where I can make PowerPoints that have some just bullet points on it, and I can speak to those and speak around it. But the thing that you have to keep in mind is, you know, constantly looking at your audience. One of the things Albert Einstein once said, I never teach my pupils. I attempt to provide the conditions in which students can learn. So that's always a good thing to think. You cannot force anybody to learn anything. What you can do is present the facts in the best way that you can, and then hopefully the student will get as excited about it as you are, and they will move on with their future. So in summarizing, I just want to say, if you're going to become an educator, the first thing you have to do is love what you do, know who you are, know who your students or your audience is, keep an open mind, and stay flexible and be willing to change and adapt. That's one of the things that I'm still struggling with, but I'm making small attempts, as in doing this webinar. So I would just like to say to all of you, good luck in the future, and if you're ever at Georgetown, feel free to stop by and see me. Thank you.